My name is Victoria Hobbs and I'm the coordinator for the Nourish Network. Thank you all for joining us today, where we'll be exploring the development and testing of the newly released Healthy Retail Toolkit, a resource that was created by the Nourish Network Healthy Retail Resources Action Team, a multidiscipline, multi-sector team led by Margaret Rosman of the Healthy Eating Advisory Service. Next slide, please. So this is our agenda for today. We are aiming to finish by 1:30 p.m. And if you have questions, please feel free to put them in the chat or wait till the end of question time. And you're also welcome to email myself or the presenters after the session. Next slide, please. Next slide. So acknowledgement of country. As we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect on the lands, reflect on the meaning of place, and in doing so, recognise the various traditional lands on which we do our business today. We acknowledge the elders, past, present, and emerging, of all the land we work and live on, and their ancestral spirits with gratitude and respect, and recognise their continuing connection to land, water, and community. I also pay my respects to other Aboriginal and Torres Strait Islander people present today. Next slide, please. So welcome. Many of you will be aware and familiar with and good friends of the Nourish Network, but for those of you who are not, Nourish Network is a multi-sector collective working to increase demand, availability and access to healthy and sustainable retail food. Nourish Network is an initiative of Deakin University's Institute for Health Transformation, which is based in Victoria, Australia, but works nationwide, and is led by Alfred Deakin Professor Anna Peters. Also led by Professor Peters is the NHMRC-funded Centre of Research Excellence in Food Retail Environments for Health, Refresh, which is the first international centre for healthy food retail research. Refresh aims to transform food retail environments to improve diet and health at a population level, and is doing this by building a business case for retailers, demonstrating that interventions which promote healthier food retail can be feasible and profitable and align with growing customer demand. If you have questions, please put them in the chat box as we go, as I said, or you can raise your virtual hand during question time at the end. The session will be recorded and available on the Nourish Network and Refresh websites after the event. Next slide, please. Introduction. Without further ado, I would like to introduce Margaret Rosman. Margaret is an accredited practicing dietitian with over 26 years experience in public health and community nutrition. Margaret works at Nutrition Australia, where she manages the Healthy Eating Advisory Service, which supports early childhood services, schools and retail outlets in hospitals and health services, and sport and recreation centres across Victoria to implement government nutrition policies and guidelines. Margaret is committed to collaborating with stakeholders at both the government, commercial and local level to support the creation of healthier food environments. Soon after the Nourish Network was formed, Margaret stepped forward to lead the Resources Action Team that developed the Healthy Retail Toolkit. Thank you, Margaret.
Thanks, Victoria. So I'm going to just talk a little bit about the journey of the Retailer Resources Action Team and in the journey of creating this Retail Resources Toolkit. We decided to come up with this idea with creating the Healthy Retail Toolkit after a Nourish Network planning day. There was actually, during this planning day, we all put our names down to be part of different action teams. And one of the actions teams was the Retail Resources Action Team. So at Nutrition Australia and the Healthy Eating Advisory Service, we thought that this aligned well with our priorities of our organisation. Number one, because collaboration is an important element of the work that we do, but also because we actually support retailers through health promotion officers or retailers themselves in the work that we do to create healthier food environments. So when we formed the Retail Resources Action Team, we went through a process of, I guess, identifying what projects we could work on. And one of the projects that we worked on was to develop the toolkit. So here on the slide, we've actually got the broader purpose of the actual action team, which is to identify and develop resources to help make it easier for retailers to make outlets healthier, and the scope. So we really had to think about the scope. So we decided, because a lot of us were Victorian based, that Victorian specific resources were a great place to start, but that we could broaden out over time to an Australian context. And the scope was also retail, food and drink outlets under the purview of governments. So the health services in Victoria, the sport and rec facilities, and any of the cafes that operate in there, and including subcontracted outlets, but not in scope, is the supermarkets and corner stores and franchises. These are the members of the active members of the action team. So, ranging from, I guess, us at Nutrition Australia, so public health professionals. We've got academic campus services from Deakin University. We've got retail food service operation from Western District Health Service, and academics from Deakin University. We also had other people from organisations drop in over time. And as you can see, when I'll talk next on the next slide, it was a project that went over a 2-year period during COVID lockdown. So we had a lot of people come and go throughout that contributed variously to the development of the toolkit. I guess, just touching on the point why we decided to collaborate. So it was an identified need that we had all identified, resources to support the implementation of healthier food and drink policies across Victoria. But we also know that best practice is co-designing retail, co-designing resources with the end user in mind. So often resources are developed, I guess, at that practitioner level, perhaps with some input from researchers. And we just thought this is a great opportunity for us all to get together and co-design from conception, which is best practice. And also developing this toolkit aligned with the people in the membership, organisational and program strategies and goals. The next slide talks a bit about the timeline of development, and you can see, if you can go to the next slide, that'd be great. Yeah. It started, and it is an example of collaboration and co-design in practice. So this is actually what happens in real life. This is the process that we went through in around October 2020. So that was in the middle of COVID lockdowns. We had a few meetings prior. We actually decided to go through and we come up with the idea of developing the toolkit. And I think we were very ambitious. We thought we might actually get it done in 3 or 4 months. So we met monthly, and we came up with a framework for the toolkit. We delegated different tasks to different people on the team. And in actual practice, it took from October 2020 to June 2021 to, I guess, come up with what we thought was a final version of the toolkit. Through that time, we did actually consult with a couple of retailers that were on site at Deakin University to get their perspectives on the content. And we were really fortunate that during this process, an opportunity arose to get some funding from the Victorian Department of Health to do some research, which Tara is going to talk about next in this presentation, to do some user testing and get insights from the actual retailers on the toolkit and how usable it is and what they would like to see to further refine it. So during the months of November 2021 to April 22, that research took place, and the analysis and the presentation and the report. And we used the findings from that research to refine the toolkit and apply the findings, get it graphically designed, make it look visually appealing, etc. So that whole process took 2 years. Tara will talk a little bit more about in more detail of the insights. So I might just go through what the end product is. So the next slide just shows the front cover of the toolkit. So I noticed in the chat and on the slide as well, there is the link to the toolkit. The toolkit was designed to be something that's visually appealing, that's a step-by-step process, an easy to follow guide to implement the healthy choices guidelines in health services and sport rec settings and university settings here in Victoria. The feedback from the retailers is they wanted it to be broken down into steps. We know in Victoria that health promotion practitioners often play a central role in working with retailers to implement effective strategies. And this can also support health promotion officers who are actually working with retailers, but it also can, it's directly developed so that retailers can understand it and follow along and understand what to do next. So this toolkit is free to download from the Nourish Network website, and the toolkit can be adapted with permission of the authors in other jurisdictions, and that in fact is what will be happening in Queensland. And the details of who you need to contact are on the second page of the toolkit. So based on feedback from the retailers, the next slide shows that what they really wanted articulated clearly in the toolkit was the business case. So basically why creating healthier food and drink environments is something that they should care about. So it was difficult throughout the toolkit to get that balance of putting in too much information versus keeping it succinct and visually appealing. But this is what we've actually landed with. So the first version had way too much information in it. The next page of the toolkit just talks a little bit about, I guess, the policies and what they will need to know. So that's the next slide, what you need to know. So it talks a bit about, I guess, the policy context, the healthy choices guidelines, and what some other feedback that the retailers gave was that there needs to be some clear links throughout the document for them to explore, I guess, if they want to dig deeper with it for any information. So you'll see here the links to the Healthy Choices Guidelines and the policy directive that's in Victoria here for health services. The next slide talks about the steps for success. So this was a key element and feedback from the retailers that it needed to be broken down into small steps. And this is an approach that is, I guess, being broadly adopted into other resources that we're developing as well. And so each part of the toolkit, I guess, digs a little bit deeper into each of the steps and provides a bit more detail around how to implement this step. So for example, I'm not going to go through each step, but I'll just go through a couple. So the next slide talks about getting your staff on board. And based on retailer feedback, each step has some information. It has some key points. It's got some key tips in a breakout box, and it's got a case study. And that's some feedback that was quite strong, that case studies are really important. So this particular one is a case study of Western District Health Service. So you'll hear a little bit more about that from John a little bit later on as well. So the next slide is a page where it talks about assessing your menu, which is one of the steps in the toolkit. And it's because it's a Victorian context, it's talking to specific Victorian tools. So we do refer to a lot of the Healthy Eating Advisory Service resources that exist on the website. And in particular, this online menu planning and recipe assessment tool called Food Checker, but also we give alternative option for them to use. So for example, if they didn't want to use Food Checker, we've got a checklist, which is actually referred to in the appendix as well. So we just try to create a few different options for retailers depending on which way they want it to go. The next slide is some information around breaking down the information. This is just an example around the step around promoting it to customers and talking about the 4 Ps of marketing and just sort of breaking out the information into digestible chunks. Finally, just that point, the next slide talks about additional support. So we have actually provided a lot of additional resources. These are all links in the document that they can actually click on, and more business sort of practice elements. The next slide shows one of the additional resources that they can essentially just pull out of the toolkit, which is a customer survey. They can just add their name of their organisation in there, and they can actually just take that out and use it. So that's an example of the survey. So I haven't gone through all the pages of the toolkit, but I guess the next slide just shows again the front cover. Just thought I'd just cover over some of the key learnings that we found during the development of the toolkit. We found that collaboration and co-design takes a long time. Like this took 2 years, but that was because there was a research project in the middle of it. But there's a really high value. So the value is developing a resource that the end user has been part of the process in developing, has got great feedback and insights. And also there's value in developing relationships between us all, because we all operate in that sort of retail space, but from a slightly different angle. We learned that there needs to be, I guess, clear project management, like all projects, and that need to continue to drive the project forward, but also that it does need commitment from organisations and different individuals that want to be involved. And like any project, there's the people that have the capacity and I guess the time and the commitment to be more involved. But there's also that space for other people that can add a bit more of a lighter touch feedback and involvement. And of course, just like all other projects, you do need budget for resource development and design, which we were able to, I guess Deakin and Nutrition Australia, the Health Eating Advisory Service, contribute to that as well. Tara's going to talk a bit more deeply about the opportunities going forward, but I sort of see the opportunities around testing the usability of this in practice with retailers, seeing what else we can actually develop, perhaps things like videos, etc., that can be embedded. But I think just keeping in mind that the toolkit is one tool around creating healthier food environments. It's part of that system of support provided by health promoters as well. So I think I'm going to hand over to Tara now to talk a little bit more about the research, and I think maybe Victoria's going to introduce her first. Thank you.
Thank you so much, Margaret. That was a great summary of the journey that we went on to develop the toolkit. And like I said, if you have any questions for Margaret, please pop them in the chat. I'd now like to introduce you to Dr. Tara Bolson-Robinson. Tara is a research fellow within the Centre of Research Excellence, CRE, in the Food Retail Environments for Health at Deakin University. Prior to completing a PhD evaluating healthy food retail policies in community settings, Tara was awarded a Bachelor of Commerce and Master of Public Health. Through her research, Tara aims to measure and produce outcomes that are relevant and useful for multiple stakeholders, including retailers, customers, and public health practitioners, reflecting the integration of her marketing and public health training. Tara works directly with stakeholders to co-create resources that support the implementation of healthy food retail practices. Thank you, Tara.
Thank you, Vic. Next slide, please, Sean. So thanks everyone for coming today. I'm really excited to be here and to be talking about the toolkit and the process that we went through. I'm going to be talking about two things mainly. The first around the toolkit development through the lens of co-creation or co-design. Margaret's already touched on that, and I'm going to kind of take you through a framework and step you through that process in case you're interested in replicating that or hearing more about it. And then I'm also going to touch on some future opportunities of the toolkit, which I'm really excited about as well. Next slide, please. So what is co-creation or co-design, and why do we do it? So co-creation refers to a collaborative approach of problem solving between different kinds of stakeholders. And the different stakeholders we'd be referring to in the context of healthy food retail implementation are all the ones you've heard about so far. We've got our retailers, staff, health promotion practitioners, and in this case, academics and researchers like me, and anyone else really involved in implementation. And our perspective is that co-creating implementation tools directly with end users are really going to lead to tools that are more practical, more acceptable, and more effective at creating change. And it kind of seems obvious, I think. And you know, it's great that we're doing that. Next slide, please. So as I mentioned, I'm going to talk you through the co-creation process that we used to develop the Healthy Retail Toolkit. If you could click, please, Sean. What you see in front of you is a 6-stage co-creation framework for public health, which has been developed by my colleague Carmen Vargas, who is a PhD student at Deakin University. And we've taken this framework and really thought about, well, how could we use this to create a toolkit? And I'm going to briefly talk you through the first 4 stages, but really focus on the implement and evaluate stage, which we've been really operationalizing through 2 different research studies. Next slide, please. So as Margaret mentioned, as the action team, we identified a need for this kind of really retail focused practical guide. And I think it's worth touching again on the deep and broad knowledge of the action team and how much that contributed to the value of the output. Margaret has 26 years in working kind of in practice on the ground in nutrition. I have 10 years in research. I won't say how many years Chris and John have collectively, but we have lots and lots of years of experience from very different perspectives, and that really contributes to the value. Along with identifying the need for this, we also conducted a systematic audit internationally of existing toolkits, and that helped inform, give us some good examples to draw on and also identify what gaps and how we could fill those. And then over the 2 years that Margaret spoke about, we created that toolkit based on our practical and academic knowledge. Next slide, please. So implement is the 5th step, and we kind of operationalize this using a research study. So we were interested to test kind of the first version of the toolkit with retailers who would be using it on the ground. We wanted to ask them, whether it suited their purpose, whether it was practical, accessible, and easy to use. We conducted a number of focus groups and interviews with 10 retailers, and we did them online due to COVID-19, but this actually had a really added benefit that we were able to access regional retailers that we might not have been able to. And I did the interviews from Sydney, so it was good for me too. We interviewed, as I mentioned, regional and metro retailers and from a range of different organisations. So we got quite a broad perspective, which was excellent. And we also really deliberately interviewed retailers who had had success in implementing healthy choices previously, and those who had never tried to do it before, or who hadn't had success in that. And that was so that we could make sure the toolkit would suit the needs of a broad range of retailers. We didn't just want it to target, retailers who'd already had success in implementation. We asked participants to review the toolkit prior to the interviews, and then we talked to them about their perceived usefulness, usability, and the clarity and the format for each aspect of the toolkit. Next slide, please. And this is just a really high-level summary of the results, some of which Margaret has touched on already, but they kind of fall into 3 main areas. Firstly, the retailers found the content really relevant. They liked the troubleshooting boxes. I think this has been renamed to tips now, so you can already see some of those kind of shifts. They really liked the practical pullouts, the marketing materials, the recommendations on how retailers could engage their staff and communicate with customers, and they thought the case studies were incredibly valuable. There was high usability of the toolkit. It was logical and easy to follow, and there weren't any significant gaps identified. The retailers identified a number of kind of enhancements to the toolkit. So really pulling out that gradual staged approach, emphasising that, further highlighting the business case and the benefits of implementing healthy choices, and also further highlighting the full range of support from HEAS, which is such an amazing resource that we have in Victoria. Next slide, please. So these recommendations, they flow very, very clearly from the findings, and you can see that, you know, they're quite aligned very nicely with what Margaret's touched on and the final version of the toolkit, where we emphasised a gradual approach, having a range of case studies embedded throughout. The toolkit really helped retailers kind of connect with their own experiences and see themselves in those case studies. We highlighted those support services offered by HEAS, and we also really put that business case and the why of implementation up front on that second page, as Margaret showed you. Next slide, please. So just a few reflections from me. The toolkit was really viewed as useful and practical in supporting retailers. In terms of the process, the testing that we did, that kind of sense check, really kind of elevated that final version to be even more relevant to retailers. And, you know, I think what I would consider going forward is what are the opportunities to kind of streamline that process and embed that co-design and co-creation element, you know, but where could it be streamlined? And what I'm going to talk to you about next is the kind of opportunity to amplify and share these co-created resources. Next slide, please. So the final step in our 6-stage co-creation framework is evaluate, and I'm going to talk about it in the context of a big research study that's currently underway. So to give you a bit of context, Health and Wellbeing Queensland is a statutory body of Queensland Government, and they're driving the implementation of a better choice. And a better choice is similar to the Healthy Choices Guidelines, is a healthy food retail policy that aims to increase the availability of healthy options and decrease the availability of unhealthy food and drinks, and uses a traffic light classification system as well. Health and Wellbeing Queensland have an initial focus on implementing a better choice within healthcare facilities with a view for expansion. And Health and Wellbeing Queensland approached us at Deakin for advice and support on implementation approaches and resources. And we saw this kind of collectively as an opportunity to test implementation support tools explicitly as an intervention. And we then applied for and were successful in receiving 2 grants to conduct this study. And just also a quick note that Health and Wellbeing Queensland also fund the use of Food Checker too. Next step, please. So the study that I'm talking about is the CREATE study, which is the co-designed retail tools for healthier food environments. The CREATE intervention has a number of different components. I'm just going to talk you through the kind of main core ones. The first one is the Healthy Retail Toolkit, which is currently being adapted to the Queensland context. The second core component is practitioner training, which is based on systems thinking, and this has been developed through a co-design process with practitioners. Some of you may have attended some of those systems workshops we've held previously. Next slide, please. And so this is kind of a bit of a timeline of the study. You know, we've done the protocol development, ethics submission, and we've got a number of health services on board who are interested in testing out the impact of these implementation support tools, which have been co-designed. And I think what's really exciting about this, at least to me, is that as far as we know, this kind of randomized controlled trial testing implementation support tools for healthy food retail has never been done before in Australia or internationally. So it's really, really groundbreaking and wouldn't be possible without the amazing research team, and also the strong partnership we have with Health and Wellbeing Queensland. So what we're going to be doing with this pilot randomised control trial is recruiting pairs of retailers and practitioners. And we think that kind of pairing the retailers and practitioners and giving the retailers the retail toolkit and the practitioners their training, that there'll be a kind of compounded impact of them being able to implement a better choice. After we've recruited them, we're going to randomise 10 pairs to the intervention, which is the CREATE intervention, and 10 to receive standard support. And this intervention will run for 6 months. And after the completion of this intervention, the control group will receive a shortened version of the intervention. So don't worry, they won't miss out at all. We're going to be collecting data on the change in the food environment. And we're also going to be collecting retailer and practitioner surveys. So we're interested in understanding the feasibility and acceptability of running this kind of intervention and this kind of study design. And it also enables us to collect power calculations for a full-size RCT. In terms of next steps, the Queensland Adapted Toolkit will be shared with all retailers in Queensland Health Services following the completion of this study. We're also going to be exploring options for a full-size RCT to test implementation tools in further context, depending on the results of this pilot study. And we're also really interested, not just in the future, but currently, to develop and share co-design tools to support implementation. As Vic mentioned in my introduction, which I'm pretty sure I wrote, it's really important to me to be doing research and be doing work that makes a difference on the ground. So if you're interested in this kind of co-design work, if you have co-design tools that you've created, please get in touch and let's share the amazing work that's happening everywhere. Next slide, please. So just finishing on my acknowledgement. So for the toolkit, the design, the Nourish Network action team, who are amazing and led by our fearless leader, Margaret, Miranda, Tari, Aja, and Victoria for their support in the interviewing of retailers for the testing, Victorian Department of Health for funding this work, and my other funding support as well. For the CREATE study, just want to acknowledge our Health and Wellbeing Queensland partners, and in particular Sheridan Clough, Dr. Miranda Blake, who's our co-lead, and our really excellent research team, and of course the funders for the CREATE study, so the Australian Prevention Partnership Centre and the Faculty of Health from Deakin University. And that's all from me. Thank you.
Thank you so much, Tara. Such an exciting time and a lot of work that you're doing, and we can't wait to see where this all goes and to have deeper partnerships with Health and Wellbeing Queensland. And I think it also demonstrates really clearly how we never envisaged at the beginning of the toolkit where it would go, but it's things are looking really, really exciting about adaptations. And again, we would encourage anyone who would like to adapt the toolkit for their setting to get in touch, and we can help support that. So next up, we'll have a discussion with our hospitality specialists, John Headley and Chris Lividitis, who are part of the action team from its inception. Chris and John provided the highly valued food retail or hospitality perspective during the development of the toolkit. Chris is the manager of retail services at Deakin University and has over 35 years of hospitality experience. Chris's experience is centred across all areas of hospitality as a director and manager in catering, major events, licensed premises, food production, and multi-store retail. At Deakin, Chris is responsible for the strategic and contract oversight of the food retail plan and operational campus retail experience across all Deakin campuses, Geelong Waterfront, Warn Ponds, Warrnambool and Burwood, and is the custodian of the 5 pillars of the Deakin Food Charter. As mentioned by Tara, I think we've got extensive experience in the action team, and Chris was a huge part of that. And John as well. So John is the Group Manager of Support Services at Western District Health Services, Health Service, WDHS acronym, in Hamilton, Southwest Regional Victoria. John's career has always revolved around food, having had experience as a successful chef, restaurateur, caterer, gourmet food traveller, and gourmet food retailer and hospitality teacher. More recently, over the past 6 years, John has moved his passion into the health industry. John and WDHS share a common vision to use their learnings to inspire and assist other health services and commercial food retailers to create healthier food environments across Victoria and Australia, and ultimately to make the healthy choice the easy choice. So thank you to Chris and John. I think we'll stop sharing the slides and we'll have a Q&A discussion. So John and Chris, I just want to check that you are off mute and available.
Right here. Thanks, Vic. Thanks for the introduction.
Good afternoon, everybody.
Fantastic to have you both.
I'm very impressed. John?
Okay, I'll start with John. John, can you talk a little bit about your experience in creating this toolkit with the action team?
Inspiring to listen to the lead into our Q&A, but from our point of view, I guess Chris and myself, it's from a retail perspective. So our journey at Western District Health back in 2018, the journey commenced to change our menu, which was laden with red and amber items, into the first 100% green outlet in Australia. So that took 6 months. The journey was very, very challenging. A lot of barriers and whatnot popped up. The complexity dealing with staff, that's not just food service staff, it was our clinicians and so on that frequented our retail outlet. It was merchandising product. It was knowledge on recipes on how to adapt those recipes to turn them into green or healthier options. And spent a lot of time with Healthy Eating Advisory Service, who had some great resources, but I guess the natural progression for us was to when the collaboration of Nourish Network commenced. And as we've heard today, health practitioners, academics, the researchers, Chris and myself's input in that resource, I think we've developed a great tool for the end user, and that's, in a sense, retailers. And from my point of view, it was to help those make that change to healthy eating a lot easier in that retail, from that retail perspective.
Thanks, John. Yeah, that sounds great. And what a huge, I suppose, cultural operational shift you had to make to get across the line. And it's probably fairly, fairly normal now in that space. And that just shows change and enacting change. So yeah, thank you. And Chris, did you have your some thoughts on this question about your experience?
Thanks, Vic. So we came from a little bit of a different perspective as far as arm's length, so from a contract management point of view and a retail leasing. So I think we brought to the group, a commercial lens after the successful implementation of the Deakin Food Charter in our retail and vending business across all of our campuses. Just to give some background understanding, 15 outlets, 105 vending machines. The scope of the implementation was basically, we measured the workflow to 680 face-to-face meetings with our retailers and inputted over 2,000 recipes in the Healthy Eating Advisory Services menu checker. So that gives us hopefully a little bit of the breadth and scope and what we brought to the toolkit.
Thanks very much, Chris. And it was great to have your insights during the toolkit development, particularly the university perspective, which I know you really lived with the Deakin Food Charter. So I'll put the question to you both. How is the toolkit different to what has come before with the other resources and support that's available? What are your thoughts on that?
Yeah, look, from my point of view, it was what we've covered here from today's webinar, and that's the co-design by like-minded people. Everybody had the same, outcome or to see a food revolution, basically, and that's to get that toolkit together with like-minded people, a skill set in one room. We've ended up with an awesome tool that retailers can can use, and I think that's the biggest point. It's the usability from a retailer point of view. I think we've done some fantastic work with everybody who was involved with that toolkit.
Thanks, John. Chris, do you have any thoughts on that, on how this one differs to what's come before?
Yeah, absolutely. I think what existed was basically sharing of learnings, especially in the tertiary sector, and looking at what was the policy at the time and trying to understand the framework. And then I think obvious from what Margaret and Tara presented was that the collaboration, obviously from people that I wouldn't normally have any dealings with. So number one was to sort of commit to documenting was pretty much amazing. The flexible real world implementation. So again, a lot of the time it's theory, but the successful strategies, again, the resource references, I think was a major thing, especially in the sector that hospitality is very much resource poor and very much hands-on, as we all know. I think the business cases, and more importantly, I think, is the ongoing support and those reference points and those channels that are available. That would have been great if I had have had that 6 years ago. But more importantly, I think the biggest attribute of sort of is the clear retail friendly language. I think it speaks quite clearly to and simply to time poor hospitality people.
Fantastic. What I'm hearing from you both is it cuts across the divide, I think, that we experience between the theory in peer-reviewed academic research and the actual hands-on practitioners. And it's that translation that I think is really unique and really special in this instance. So what are some of the challenges that you both feel you experienced in creating the toolkit?
From my point of view, again, I think it was developed through COVID, which was a very difficult time for everybody. I know in health it was an extremely difficult time and challenging time. But I think the beauty of having a collaboration of multiple stakeholders who were able to stay on track and complete the resource in a reasonable time. And I think 2 years maybe sounds like a long time. Outside COVID, I'm sure we would have achieved that, maybe 3-6 months possibly. But I think with all the stakeholders there, we achieved a great outcome, great tool. And from my point of view too, I guess to have a strong group, there was healthy debate amongst us all. And through healthy debate, we end up with a tool that's best suited by the end user, I guess.
Yeah, thanks, John. And I think when you're breaking new ground, things do take time, don't they? And contributions. So yeah, I would expect with the next iteration, things will move even faster. Chris, do you have any thoughts? What were your challenges you experienced?
I think overall, as a group, as the robust debate John mentioned, was the providing, a summarised content, in commercially relevant to a specific cohort that we were sort of trying to look at the broadness of the hospitality sector and its multiple categories. And the settings. So I think without bringing the collaborators together, the potential for the toolkit not to exist. So I think the group in itself, in the discussion was bringing it together with and being respected of other people's perspectives. So I think that was a challenge in itself, and COVID, of course. But overall, I think we had some strong opinions, especially John.
Yeah, like you said, there was some healthy debate, which is what's going to happen when you have a multidiscipline team, I think, as well, because everyone brought their own perspectives, which didn't always align initially, but we got there in the end, which was great. And what are you both excited about for the toolkit going forward?
Oh, look, I think it's just a high quality resource that we've developed. Obviously, we'll have continuous improvement behind that tool as well. From my point of view, I just hope others adopt that toolkit. It does make life easier, as Chris sort of mentioned. I wish I had this toolkit 6 years ago. Exactly right. We did struggle. There's a lot of barriers. We've both been through it. And this toolkit, I hope, and I think it will make it a lot easier for other retailers to adopt those strategies to have at least healthy choices within their menus. Another reason we've been behind it is obviously there's policy directive there. I'm sure there's a lot of health services online today. 2023, we need to adopt the food strategies there. So this toolkit, I think it's very timely that it's been released. So hoping it makes that journey that we've had a little bit easier for those retailers that have dialed in today.
Yeah, sure. And just to note for our interstate participants today, I think there's so many crossovers there, might be a bit of difference in terminology and classification, but it's where I think everything's moving in government to healthier, more nutritious food. So again, I think there's certainly adaptability moving forward. Chris, did you have some thoughts on that?
Yeah, I think in simple terms, it's real world input. So it's actual factual implementation. And I think it's representative of multiple stakeholders. And again, poor old hospo people, sorry, time poor, resource poor, focal point is not on, again, a monumental change. So the fact that it's available so readily to the sector, I think it's a huge, huge plus.
Fantastic. And how do you think we are creating a different way of working going forward? I mean, how has this changed how we work really in this space?
Look, I hope those who have dialed in today sort of listen to how we've co-created this tool. And from my point of view, it's hugely valuable to get the health practitioners there, the academics, the research is a huge part of that data is so important on how to build a successful tool. So I'd hope that others may put their hand up to join the Nourish Network. It's a great network. If you're passionate, like we all are, Chris, very passionate, and happy to look. I think being around like-minded people, it's just a great network to be involved in, and you see. You start making a real difference, and I think that's what we're all in this space for, is to make a real difference, and that will come to fruition.
Brilliant. Chris, do you have any final comments?
I just think in our day-to-day operations, I think we're very singular and focused in operational mindset. So I think from my perspective, the opportunity to work with key stakeholders in different specialities and subject matter experts, I think enabled this, really well thought out sort of toolkit that can be actioned and brought to industry. And I think it's real time. And I think I saw in the chat there a couple of years, but when you look at its add value, as Margaret mentioned, and I think having access from our operators' perspective to people like Tara, that again, those inputs have been considered. I think, it's a big positive.
Fantastic. Well, we now have time for some audience questions, and I can see some coming through in the chat, which is fantastic. I will raise those. And thank you again to John and Chris and all the our panelists. It's been great to hear your perspectives, which I think is something that potentially us in health promotion and research don't hear from as much as we would like to. So yeah, again, really, really valuable. So anyone, if you would have questions, I will start with Krista, who's written in the chat, great presentations. Thank you, Krista. And her question is, given government agencies often have third-party retail providers, can the requirements for healthy choices be embedded into agreements and tenders? Now, Chris, I know we work together on this in terms of the contract KPIs, if you might want to touch a little bit on that one.
Yeah, there's several options as far as government contract suspension of interest. I think our approach was, again, our contract management agreements incorporated the principles of our Deakin Food Charter. And then again, from a retail leases perspective, it was all about key performance actions that could have been measured in and around and incorporate the goals or objectives of the charter. And I think that's the easiest way to sort of broker it. And I think a lot of it, and as being through the messaging from everyone, is that collaboration. So taking that approach to be able to identify the intent again, and then being able to document it is a way forward.
Thanks, Chris. And keep the questions coming through. Brilliant. So Chris Dubler has commented, what impact has the implementation had on retail profitability? And that's always the $1 million question, I think, isn't it? Particularly for the business owners themselves. And what problems do retailers raise when considering using the toolkit? If any of the presenters would like to jump in to comment on this, please feel free.
I might jump in
Thanks,
and
Margaret.
just talk about, well, we don't know what, I guess the implementation has been occurring even before this toolkit came along, but we know that there is some good case studies where they've actually implemented healthier changes. For example, Alfred Health is a classic one. There's a few on the Healthy Eating Advisory Service website where they've actually made some changes and it actually hasn't impacted the bottom line. And I think maybe John could even talk to this because you implement that across you went 100% green at in your health service. But in terms of problems retailers raise, quite often there's that resistance to change. And I think that happens with any change occurring, and fear, I guess, of losing profitability. But I think John and Chris might be able to talk about that.
Thanks, Margaret.
It was look, it was an important part of our journey, and I think finance, obviously, for any retailer, is important to be a sustainable business. I know we are a government organisation, however, coming from a private enterprise, that was really a passion of mine to ensure that profitability was a key driver. From our point of view, as Margaret sort of said, it was. People were, if you have a strong business plan, you have the right whys and why are we implementing this, the right marketing strategies, believe in your product, and you'll see true value. So from our point of view, it worked. That's what we did, and that's probably coming from a private background of marketing and whatnot. We saw a 30% increase in sales. So that was a sort of debunked the myth that sales were going to decline. It was, so if you're passionate and you make the right business plans and marketing, this will work. It's something that we've tried to keep data right through the process back in 2018. Unfortunately, COVID has sort of thrown that off the scales a bit because being a health service, we lost 30% of our income through the community because they just weren't allowed into our retail outlet. So, but that's something that's going back now that we're coming out of COVID. We're definitely keeping those figures, and look, I'm pretty passionate about profitability and keen to talk offline to anybody.
Yeah, brilliant. Thanks, John. And I think sometimes that's questions that we, as semi-government universities, don't really want to talk about. And I think it's really important to be brave and that we consider that. And we have attempted to do that in the toolkit. So thanks for that offer as well, John. Lisa Bressington, thank you for your question. Is there a self-reflection exercise for retailers to position themselves on a timescale to indicate when they thought they were offering the healthiest choices since opening the food premise and what that trigger was? So example, before COVID or other key triggers to change their menu offerings. Do any of our presenters have some thoughts on that? I think part of the toolkit, I'll jump in, actually has, there's an area where they can do a bit of reflection and to look how far they've come and do that sort of check-in periodically, because that's also important, I think, to motivate your staff. And I think that the toolkit provides for that as well, is that self-reflection to see how far they've come. And I know when we were working on the Deagon Food Charter, that was really huge to look at the before and after photos, which are fairly macro, but it really was quite powerful to see the difference in the beige chips and hot dogs, and then to see the beautiful, colourful, fresh offerings. So I think, yeah, Lacey, you make a great point that that self-reflection is really important.
Yeah, we have a more formal approach as far as auditing the planograms and some of the menu design on a sort of monthly basis. So again, the sort of mindset is twofold. So operationally, it's not so much cathartic, but it's also a P&L exercise in redevelopment of an adjusting menu design, looking at tracking. So I think it's a multifaceted discipline to be able to look at the staged approach. So our sort of advice and sort of measuring has been, again, looking at the percentiles of the menu offer, again, working with the sort of success in designing and uptaking seasonal adjustments. So it's pretty broad and complex, and happy to take and have a discussion in more detail.
Thanks, Chris. I think we only have time for one more question. So Jenny Binden, thanks for this one. Have you thought about collaborating as well as local government and state local government associations and a business chamber of commerce? So Jenny, I think that's a really great question about linking business in, and I think that's our next really key step. Australian Retail Association, getting those retailers really on board. We are doing that to a certain extent. We have strategic advisors who are senior hospitality specialists, but that would be great, and we would certainly welcome any thoughts you have on how we can take that really next major step forward. If any of the presenters would like to add to that point.
Just adding, I put some links in the chat, and so has Dr. Miranda Blake, but Miranda leads a Nourish Network action group on local governments. So there's a lot of work happening in that space, including a recently funded NHMRC trial, which is supporting local governments to make healthy food retail change. And Miranda's popped the link to that in the chat too. So lots of exciting work in this space, but always keen to hear more and connect with anyone who's interested.
Fantastic. Well, I think we're nearly at time. So thank you very much for your questions. And to finish up, I'd like to put out there, what are the next steps for the toolkit? We would love to hear your feedback on it, what you find about it, what your retailers think about it, your health promotion practitioners, and those users on the ground, like Tara and Margaret and everyone noted, what they actually think of it. So we would love that feedback. And if you do plan to use it to support food retailers or as a retailer yourself, you know, how you found it and what areas were useful. So yes, we would love to for you to and encourage you to get in touch if you'd like to adapt it to suit your setting, particularly organisations from interstate. You're already working with Queensland. We understand you do operate under slightly different classification systems, but we've broken this ground and we feel very confident that we can expand it to different settings. So to close, I would like to thank everyone for attending, to our panelists and to you all for joining us. We'd really value your thoughts on the webinar. So if you can please complete a short survey, which should be shared in the chat. And please get involved. Being part of Nourish Network teams, you may have the opportunity to be part of creating and named on tools and resources, have potential authorship on academic papers if there is a research component, develop committee experience and build and diversify your professional networks. And if you'd like to keep up with our work and that of Refresh, please subscribe to our newsletters and follow us on Twitter and LinkedIn. So thank you so much for attending and enjoy the rest of your day.